What is the best genetic test money can buy? Well, in the past, a lot of times we would talk about 23andMe and Ancestry being the best monetary value you could get to get your raw genetic data. And then you take that genetic data, run it through a compiler like NutraHacker, and then you get a pretty good report of your genes. Hey, that's still a great option. As we know, 23andMe is going through some crazy times right now. Your data, who knows where it's going to be. I personally deleted my genetic data with 23andMe because I don't want that to be sold to anyone else. And I never did Ancestry, but who knows where Ancestry will be one day too. That's why we partnered with MaxGen Labs, which is an up-and-coming genetic testing company, but they are dedicated to privacy. They're dedicated to keeping and protecting your genetic data because it is your data and should not belong to anyone else. So we have the Works MaxGen test that we offer through our practice. And this is a very specialized panel that Dr. Purser and I developed to cover one thing, to cover all of the genes around homocysteine, but also all of the methylation genes with MTHFR, MTR, MTRR, GGH, all those ones you hear us talking about all the time, as well as many other genes around fibromyalgia, SOD, and glutathionaires. They're all extremely important. This test is the most beneficial for our patients in the way that we treat our patients. Because this gives us the overall snapshot of what we're looking at. The Works MaxGen test through Dan Purser MD, that is the one that you want. That's the best one money can buy. We bundle it with to do a consult so that you can also work with us directly, and we can go through your report and give you a very specialized nutrient guide to help you on your way. So MaxGen, the genetic test, is a great place to start. But even before then, if you're wanting to just get started, or if you're an existing patient and you're starting to drop again, you're starting to feel fatigued again, getting more pain, something's off. And that's where we do our CMA intracellular testing. That one is our gold standard. Every patient, every employee at our office, we try to get them a couple times a year just so that we can keep everyone in their optimal performance. CMA intracellular testing with redox. That's the one you really want to start with. So our genetic testing pairs perfectly with our intracellular testing. What Dr. Purser always talks about is it's the genetic errors causing intracellular vitamin, mineral, and amino acid deficiencies, micronutrient deficiencies inside of your cells. And so you can't change your genes, not yet. Hopefully someday down the road, we'll be able to alter things and do things. In the meantime, we do very specialized supplementation. And this is what allows for personalized care and personalized treatment plans for our patients. We look at what you're deficient in, we look at what your genes are telling us that you're going to be deficient in, we bridge that gap and fill all the holes, and symptoms disappear. So if you're fatigued, have anxiety, have depression, have pain from fibromyalgia, something's wrong. We can help. If you have any questions, reach out to our practice. Denise and the rest of the front staff, Denise and Brandy, all of them are so happy to help answering the questions. We also now have Justice, who is a master paramedic, who's now certified in the Purser Wellness protocols, and you're able to consult directly with him as well. So look out for all these great options.